There is a new high-tech treatment for a tremor disorder that strikes millions, and it has the potential to help many more, perhaps even those with Parkinson's disease. On the Health Watch tonight, health reporter Stephanie Stahl follows one of the first patients in Philadelphia.
The simple task of drinking water was an ordeal for Jim Neihart. He has a common movement disorder called essential tremor that causes his hand to shake uncontrollably.
You can't do a lot of things that you want to do.
The tremor started about 10 years ago. It's not known what causes it. For Jim, it's especially debilitating because his other hand is prosthetic. He lost it in Vietnam when he was gravely wounded by mortar fire.
I'm very limited. I've learned to work around limitations my whole life, but this one really slows you down quite a bit.
Hoping to get his life back, the Delaware grandfather turned to Penn Medicine for treatment with a new non-invasive technology.
I think it's magic. I think it's just absolutely fabulous.
Dr. Gordon Baltic is using high-frequency ultrasound to zap the part of the brain that causes tremors.
You're creating a thermal lesion which is irreversible. However, it has huge, huge promise.
MRI is used to pinpoint the ultrasound.
How are you doing?
To make sure it's hitting the right spot with the correct dose, Jim's writing and movement ability is monitored as the treatment progresses.
You have to be careful with it because there's no eraser on the pencil.
Right after the treatment that Jim says is not painful, he's put through a series of tests, and he's able to use his hand without shaking. And a week later, he's back for a checkup. Did you notice it got better right away after the procedure?
Right after.
Wow. Now, for the first time in a decade, he's able to write 3 important words for his wife. I love you.
What's it feel like to be able to write that?
It's very nice.
He's still getting used to using his hand again, but the tremor is gone. A week before it was this, and now?
It's incredible. It's incredible.
So he can go back to enjoying soup, signing his name, and fishing, his other love.
Now, Jim chose this new therapy instead of surgery after the drugs stopped working. His tremor is now expected to be gone for good. It is really remarkable. We were there watching it happen, right? Wow. And in a non-invasive way. Right. So it's terrific. And potential for a lot of other things, including Parkinson's.
Definitely. Indeed. Great news.
Thanks, Steph.
Thanks, Steph. Appreciate it.